So you're very welcome, everybody, really, to this Thursday evening Ikigai webinar series. This evening is the the dental hygienist panelist discussion. So even though we shouldn't be, we do have a little bit of competition with the therapy panelists. So we kind of like to get the more numbers. It's just a bit of a joke.
Do this.
So I'm actually going to kick it off and get going straight away. And we're going to start. We've got this evening, we've divided it up in the questions. We've got patient education, interprofessional collaboration, regulatory changes, technology integration, continuing education, challenges and opportunity. I'm delighted to have the panel here this evening. We've got Wenda White, Jules Fisher, Fiona Perry, Amanda Harborough-Harris. And I'm going to get them to introduce themselves while everybody's coming in. So on my screen, I've Wenda first.
Hi, I'm Wenda White. I work in Dublin Dental Hospital and on the clinical side of things, and I work in private practice 1 day a week.
Thanks, Wenda. And Jules?
Hi, I'm Jules Fisher. I opened the dental hygiene studio 5 years ago now in Wallasey on the Wirral, and we're just a direct access hygiene only clinic. And I work every day.
Thanks, Thanks Jules. And Fiona?
Hi everyone, I'm Fiona Perry. I up Flying Scotland mobile hygienist service 5 years ago as well.
Oh, another 5 years. Wow. Thank you, Fiona. And Amanda?
Hello. I qualified 10 years ago last week as a hygienist. Prior to that, I was a dental nurse. I've just won Hygienist of the Year. And I also won it 5 years ago. Whoop, Anna, thank you. I work with Ikigai and one of their clinical educators, and I just work in a general mixed practice where I've been for 8 years.
Thanks very much, Amanda. And I'm Siobhan, the coordinator of the Ikigai Oral Hygiene Programme. So I work behind the scenes putting things like this together. So we're going to kick off straight away and go into patient education. And I'm going to ask the question here. In what ways can dental hygienists enhance patient education to promote better oral health? Amanda, would you like to go for that one?
Yeah, sure. Okay, so doing demonstrations in the mouth with electric toothbrushes, and then getting the patient to demonstrate it back. Models are sort of a little bit old school now. Diet education, so talk about Stephen's curve, check how many sugar intakes they have in a day. You could do disclosing solution or tablets and then get them to use them at home. Interdental brush advice, you could use visual aids, so posters and pictures of progression of diseases, that type of thing.
What about, do you have any, do you use an iPad or do you have any integrated digital systems for education?
Yeah, well, actually, we've got an orthodontist on site, and I've just filmed a video for the people having braces fitted on how to look after fixed braces. So once they've had their braces fitted, they then sit in reception and they have to watch on the iPad the video, which then gets also airdropped to their phone, so they have it at home so they can refer to it as well. And
excellent, yeah.
We've also got quite a few YouTube videos that patients can refer to, and Instagram. I post things on my Instagram for patients to watch.
Very good.
Thanks.
Do you want to add to that, Fiona?
I think that's fantastic, Amanda. I think it's important to encourage who you work for to have time to do quality oral hygiene instruction. Maybe utilise your dental nurse to help you as well, and pick up when the patient's speaking to that maybe makes you think, well, do they fully understand? Do they really use their electric toothbrush? And it's just having time to explain the basics, the anatomy, the reason why plaque's there, and as Amanda says, using the physical demonstration and helping them utilise their own brush in their mouth.
Very good. While we're staying on education and back to you, Amanda, on this one, how can we effectively address health literacy among diverse patient populations? Quite a difficult one. I know you've done quite a bit of work in this area, so that's why I'm throwing that one back to you.
Yeah, okay, so you could make sure that your staff base in the practice is more diverse. You could have perhaps translators on demand, sign language people to help. Knowledge of different religions and cultures always helps as well. Having like a patient portal so they can take control of their own health by looking at their own records and, you know, using visual aids, being clear and concise with the message that you're trying to portray to people, so not using massive lengthy sentences. Is that the type of thing you're...
Yes, yeah,
Yeah.
very good, very good. Just going into professional collaboration. Oh yeah, sorry, Fiona.
I was just going to add to that again, using IT with translations on your phone, and also using pictures. I have some dementia patients who have gone back to their original language, so I know how to say "open your mouth" in German as well as various other languages.
It's amazing what you can find when you're learning languages now,
Yeah.
isn't it? Yeah. So what role do hygienists play in interprofessional healthcare teams, and how can this collaboration improve patient outcomes? Just going to stay with Amanda again on that one, because you see, these seem to be your kind of area, Amanda, and then we're going to go on and ask Jules the next one.
Yeah, I mean, you could collaborate with oncology departments. I mean, they always need advice on oral care, especially people going through chemotherapy. And you've got some fantastic hygienists out there publishing books and leaflets, and, you know, palliative care teams going into, you know, respite places to educate the healthcare staff and doctors and nurses. I mean, you can't just assume that everyone knows everything about dental. You'd be surprised, actually. Into professional development, like for example, when COVID was around, nurse hygienists being utilised to give the COVID vaccine, that type of stuff.
Yeah, and even like if we think about other healthcare services, so like referring, if you think about positive health or the pillars of lifestyle medicine, referring to nutrition, maybe sleep therapy, substance abuse, you know, there's all kinds of things really. Yeah.
Speech therapists, and for especially for tongue-tied patients, and have that cut, but then they need to learn to use their muscles again.
And also as well,
Exactly.
like helping to prevent pneumonia for people that have had strokes, like with debris being breathed into the lungs. That's quite a big problem.
Absolutely.
And in residential homes as well.
Yeah. So, Jules, when we look at the regulatory changes, what recent changes and regulations or scope of practice have affected dental hygienists, and what can we anticipate in the future?
I think obviously the most common one is the Human Medicines Act of this year. They passed exemptions in June 24 this year. So basically it said following a completion of a training course, dental hygienists and therapists will no longer require a PGD or a patient-specific directive from a dentist. The only caveat is that they need to be appropriately trained. So I think the NHS is running a course in November, but there's also other private courses that we can do as well, that are kind of popping up. So, you know, kind of I think that's the latest thing, but I think it's just something that's evolving all the time, isn't it? The regulations are changing, and, you know, I think, you know, that's just obviously to do with the local and the fluoride, but there's lots of other things that, you know, kind of we're pushing for. We're never happy as hygienists and therapists, so we're always pushing for the next thing.
So what does that mean for you? Is that a massive, like, positive for you as a dental hygiene practice owner?
I mean, yeah, it certainly kind of, you know, takes away some of the barriers, whereas previously being, you know, a dental hygiene practice owner, even though I own the practice, I'm unable to purchase fluoride and local. I have to get a dentist's GDC number and their permission, and I have to get permission from them. It doesn't take away some of the other issues, like being able to buy things that are specific for the drugs kit. You know, I can't physically buy midazolam or adrenaline or things like that. So there's always things that we're kind of going to be working towards to make it a little bit easier. But yeah, it's certainly a big step in the right direction.
I had no idea about the drugs kit.
Yeah.
And Fiona, is it going to make a huge difference to your community practice?
Yeah, just like Jules, to not have to find a dentist to sign off purchasing of fluoride. I don't use local anaesthetic, but I use topical anaesthetic quite a lot. It's just a huge hurdle that, you know, there's less red tape around to do. It's brilliant. It's fantastic. And what I'd just say about the training courses is I did read somewhere just making sure that when you do your training that it is accredited and allows you to be signed off.
Okay, and
competent to do that as well. But yeah, a great move forward. But
your internet's just going in and out, Fiona, so I'm just going to go on to the next question and say, how can dental hygienists advocate for their roles within the evolving dental landscape? I'm going to pass that to Wenda, because you've done a lot of research, haven't you, around lifestyle changes?
The lifestyle medicine. Yeah. Well, with the World Health Organization and emphasizing on integrated and equal healthcare, we have a significant role in advocating for the role of oral health and raising the awareness between oral health and overall health. And that aligns with the World Health Organization emphasis on non-communicable diseases and the links between oral health and diseases such as diabetes, cardiovascular diseases. So we could be at the forefront of promoting public health and delivering better patient holistic care. Really.
It's interesting, isn't it? Because the World Health Organization is calling on governments to do something about prevention with non-communicable diseases. And the governments are now calling on us. So for the first time ever, they're calling on the mid-level professional, which is us, so dental hygiene, dental nurses, and so on. I think it's a very exciting time. And to quote the Irish dental officer, she said, we're in the right place at the right time.
Right. Yeah.
So however that landscape, and I know you've done a lot of research into that, Wenda, you know, into the lifestyle medicine and the dental hygienist, and incorporating that into appointments might be a thing of the future.
Yeah. Yeah.
It couldn't be in 30 minutes though, Wenda, could it? We can't
Sorry?
fit any more. We can't fit any more into those awful 30 minutes.
Yeah.
We're trying to stretch out our appointments, make them longer.
Longer, yeah. But they certainly want to emphasize on the multidisciplinary part of it as well, so approach to the healthcare, and we can be part of that.
Definitely. Thank you. How is integration of digital tools? So when we look at the telehealth, electronic health records, how does that change the practice of dental hygiene? Go to Fiona, because I know you've done a lot around telehealth, and haven't you?
So, yeah, I've turned my iPad off, so hopefully that will be better connection. Anyway, well, with some of my patients, especially as we came out of COVID, we all started learning to use FaceTime to look at patients and help diagnose to a degree, but really help them with their oral hygiene. And even now I have, because I work in very rural areas in Scotland, but I might not be back for 6 months. So I often have a 3-month check-in, and I can see where they're missing that right hand corner because they're right-handed, or they're not getting that interdental brush in between a certain area, and I can encourage them to do that using FaceTime. But there are also lots of other tools out there. There's a lot of AI where you can scan teeth. The Sopro's great for showing decay, showing inflammation, and a great tool for the patient to see what's going on right at the back of their mouth. And also there are all sorts of scanners, which I think was Amanda talking about, that you can use to scan for retainers, night guards, mouth guards, and things like that, without having to carry around a lot of impression material and things like that as well. So I know that you can get handheld x-ray machines as well. So as hygienists, we can do oral health assessments out in the rural areas, send that to the dentist, their registered dentist 100 miles away. They could sign that off or have a discussion about the treatment, and that patient just needs to come in for treatment rather than traveling, all that travel, all that carbon footprint disappearing.
Sustainable.
Like, who would have even thought when we qualified all those years ago
I know
that this is the way it would be going, you know?
That's why I love our industry.
I know.
It just moves so, like so organically, doesn't it? I love it.
Absolutely.
In America, they use all those tools. Dental hygienists use those tools, and they do get it is now being signed off by the insurance companies as an examination. So when will our insurance companies start backing us to support rural areas and communities that are service deprived, not necessarily financially deprived?
This is educating the insurance companies.
So keeping with these emerging technologies, Amanda, what do you see the potential impact on dental hygiene in the next 5 or 10 years?
Well, funny, as Fiona mentioned, I was talking to her about the Trios machine. I love it. It's my new favourite tool. I have it set up in my surgery all day long. I use it for whitening. I can't do retainers, that's out of my scope of practice, but things like I was talking about monitoring a patient who's got recession. So took a full scan of her mouth. It's saved on the computer. You don't have to pay to get study models made, so it's relatively cheap for them to have this done. There's loads of other tools. I mean, you've got lasers, so things like not damaging adjacent teeth, being a bit more precise. AI, as Fiona mentioned. Oh, there's loads of technology. It excites me a lot.
Florida probe. And there's
The
so many
Florida
different
probe,
scanners, isn't there?
Yeah, there's a lot. I mean, you've even got genetic engineering of fetuses, that you can just go so far with it.
Oral hygiene apps. Anybody had any success with any of those?
The Oral-B one. And
The Oral-B, yeah.
You like that one?
Yeah, and I mean, the IO connects to your phone, and so you can teach patients, or they can monitor their own brushing.
Yeah.
It tells them if they've missed anywhere.
I'd like an app that you could that you could put up to the mouth and it would show the bacteria in the mouth. We've seen one of those little devices before. If you could have it on the phone.
There are little cameras that look for mouth cancer
Yeah.
and stuff like that, which are really clever. So you could possibly just use a disclosing tablet.
I think there is a company that does do that with disclosing, and then you take a photo and it shows you where you've missed, and then it records it, and then it reminds you as you're brushing. There is,
but you have to touch the tablet. So you see, what I'm thinking is that it would automatically just show up. So a little bit like the camera there, the Sopro camera, something like that on an app.
With technology,
it'll be there soon.
I should have kept that to myself, really, shouldn't I?
Yes.
Yeah, so with technology, you've got
if everyone leaves £100 donation, we can get it built by tomorrow.
Yeah, definitely.
Care homes with toothbrushes that can monitor whether the healthcare assistants are actually brushing the patient's teeth.
Yeah,
and they also have in care homes AI that instead of having someone helping you learn to lift, you can put on one of those 3D scanners and do it with somebody beside you helping you learn how to do that. And I've when I've been at some of the care shows, I've talked to them about toothbrushing as well.
Brilliant. Yeah.
Really
Yeah.
good.
There probably just needs to be some kind of positive reward for carers. They're so busy, aren't they?
And
Don't
so
think they
underpaid.
don't mean not to do it, but anyway, there's probably some kind of positive reward that we could come up with.
Mm.
Go into continuing education.
this is where
'cause Wenda does a lot in the hospitals, in Dublin Dental Hospital. Tell us what about ongoing education for dental hygienists. What topics do you think we should be prioritising?
Well, advancements in technologies, new research and changes in regulations here in Ireland are probably the ones that, as we're looking to the future, but advanced clinical techniques and a holistic patient care, it ensures that we would remain an integral part of the dental team. And apart from the obvious, just keeping up to date with all new regulations which are changing in Ireland. In England, you're ahead of us, ahead of us.
And when we think about the topics, like staying on topic and prioritising going forward, if we go back to that preventing non-communicable disease that is really at the forefront at the moment. So what topics around that, Wenda, would you think?
Well, the oral systemic health connections, the effects, the diabetes, the heart disease, bringing all of that to the chair, mental health and wellness of both the patient and preventing burnout for the hygienists. And
some well-being.
Patient care and safety, and
well, a coaching approach. We're still a little bit stuck in the tell and do, which we now know that the research shows. Like, has any of you here been told what to do?
No. Definitely not.
No.
Don't do it, but yet we still kind of think it's
and
okay.
It doesn't work.
No. So
and
I
that's
think
where we need to be sorry.
So I think that's where we need to maybe look at incorporating coaching approaches, and they have to be brief and fast, like chairside with patients. But it's going back to the open-ended questions and maybe learning some coaching models. So that might be something that we could maybe prioritize going forward. And when we think about education, what's the platforms out there that you all use for your education, for your verifiable CPD? Of course, this one.
Yeah, I was going to say Ikigai. Dentino tubules. Can never say it.
Tubules,
Yes,
tubules.
very good.
Keeping up with your...
Which one?
FMC. BSDHT. GDC.
Keeping it...
All the associations do really good CPD, don't they?
Courses, attending courses. Menu. There's loads.
Even, Agilio is really good for the whole team.
That's really Fiona.
But also, if we're going to be professionals, if we're going to be professionals and we're about coaching, it might be out with dentistry that we need to think about. Running a business is a total different thing to being a clinician, and there is a huge loads of skills that are required to do that. But even just coaching your patients, learning real coaching skills to allow the patient to be able to develop their own cleaning methods properly.
Yeah, so
I think we should be
business consultancy, really. Business consultancy, is it you say? Yeah.
I find the Dental Hygiene and Therapy Network really helpful, actually. And that gives a lot of advice. It's not necessarily going to get CPD from it, but it's really helpful.
Yeah, I agree.
Yeah.
Particularly as a hygienist practice owner, sometimes you can feel quite lonely because you've not got other clinicians and to kind of bounce things off. So sometimes just typing a quick question or Googling in the group, like you were saying, Amanda, it really does help.
Yeah, and you can put yourself as anonymous if you feel a bit silly, but people generally are nice.
They're not,
Is that your support? What other support cushions do you have?
Friends that are also qualified at the same time. We've got group WhatsApps.
Yeah.
We ask each other questions, and we know it's judgmental.
It is good to have
I think peer review is really good, kind of bouncing ideas off other, clinicians, WhatsApp groups,
WhatsApp.
coffees, glasses of wine,
Yeah.
anything goes in here.
Well,
Yeah.
like, I ask my principal for advice quite a lot, and he's really nice and gives good
That's
advice.
good. So is he like a mentor?
Yeah, he's lovely. Yeah.
Yeah, that's good. Yeah. So, Jules, what are some of the biggest challenges currently facing dental hygienists?
Well, I think there's quite a few if we delve, but I think some of the most notable ones are things like recruitment and retention. There's a shortage of dental hygienists, particularly, as I'm sure Fiona will say, in rural coastal areas. Also things like mental health and burnout, kind of also patient cancellations, no-shows, NHS long waiting times. I think short appointment times, no nurse support. I think you've got to kind of fight for your little corner of your practice as well, so I think there's lots of challenges, but I think there's lots of little ways that we can kind of all support each other, like we were saying, kind of just bouncing off things with somebody else and trying to kind of get their opinion, and you feel less lonely. But yeah, I just think there's quite a few challenges really. But there always has been and there always will be.
There always has been. But there's a lot of things going right in some practices and for a lot of dental hygienists and therapists. So I think it's about looking and seeing what they're doing and what's working. And then, principals are very open to what works well.
Yeah.
So if you can have examples of what's going well and bring that back and incorporate that into the practice. I think one of the challenges, particularly say here in Ireland, is that dental hygienist roles are like gold dust. So what's happening is the waiting lists are running into next year.
Yeah.
So when you're trying to make appointments longer, that's very difficult to start incorporating in, and then it makes the waiting lists longer. So that's a huge challenge for us in Ireland at the moment.
Yeah, and it is in England as well.
As I say, I have that challenge as well.
Yeah. I mean, I personally, obviously being a private practice, I work 5 days a week. I have a Sunday off and I have a Monday off, but I've got clinicians working on those days, not on a Sunday, not that bad. But kind of we do try and kind of incorporate longer waiting times, because like we were saying before, kind of it's all about delivering all of those extra things that that we need to kind of help patients be educated and take control for their own kind of oral hygiene. And so for me, that's one of the things that is just a must, longer appointment times to be able to fit everything in.
Yeah. I think when I look back at my career, the happiest I ever was when I had an hour for an appointment, and that was just standard in the practice that I worked in. But I fought long and hard to get that. When I look back, like, that was the job,
Yeah. Because I think if you've got time to deliver the message, you've got time to be stress-free, you've got time to be able to coach the patient, and it's not just, look, you need to do this, do that, go, okay, bye. Kind of, I think it makes such a different playing field, really.
So it saves them money down the line, because they'll need less appointments because they'll be looking after themselves better.
Exactly.
If they just got to realise this.
Yeah.
I think patients are also connecting oral health to systemic health as well, and they're looking, like they have a PT for the rest of their body, they're looking for a PT for their mouth as well. And I think there are people out there happy to pay for quality coaching.
Yeah,
for sure. Let's talk about public health and community outreach. How can dental hygienists contribute to public health initiatives and community outreach programs? What do you think of that one? So when I first started, when I relocated to Ireland 10 years ago, I opened a practice within a practice. So I didn't even have one patient. So I went out into active retirement groups. I went into schools, the local wildlife park, and I ran workshops. But some of them I did like, you know, just as kind of a marketing or, you know, as part to let people know that I was there. But then I started charging for those workshops and I was really busy. It was exhausting though. But what do you think of that idea?
It's good if you've got the time.
Yeah.
I think it's
we do actually make time to go out into primary schools, and we kind of do little drop-in centres for parents and carers, so that if they, because obviously we were saying, you know, locally there's quite a few practices that have come out of their NHS contract, and that includes for children as well. So there's a lot of patients locally who have lost their NHS service even for the children. So we do like a drop-in clinic for parents and carers to just kind of chat to us about diet advice, and you know, just things that they're worried about for their children, so we can signpost them in the right way. Or as well, you know, kind of patients who are bulimic. We've got an online group that we've kind of worked with them quite a lot, because there's a lot of shame associated with bulimia and all of that, and their dental issues. So we kind of do quite a bit of work with those patients as well.
Oh, I'd like to know more about
That's-
that,
yeah.
Jules.
yeah.
It's
And same here.
kind of, sorry, Fiona.
No,
It
no,
kind
no.
of
I was just gonna.
started, and then it just kind of took on a life of its own, really. But yeah, it works really well.
Right.
I was just going to say that that's the same up here, is that because of the NHS dropping children, we now do a family group appointment where the dental nurse and I do disclosing with the children and diet discussions and stuff like that, because parents are concerned that their children haven't, and there is a percentage of children who haven't attended the dentist because COVID knocked them out, and then the anxiety of going into a dental practice is quite big as well.
So at my practice, we've got dental nurses that have been trained, and they actually have their own appointments, and the patients come in. It's brilliant service. It's free. The kids get the disclosing done. They're not allowed to clean their teeth, but they can show them how, obviously demonstrate. I think it's a fantastic service.
That is a brilliant initiative, isn't
So
it?
good. Yeah.
And can you refer your patient for oral hygiene instruction? Are they an oral health practitioner or are they a dental nurse?
They're a dental nurse. So they're called dental care practitioner, I believe. So it's a DCP appointment, and I think the NHS actually pays to practice, like it's like £1 a patient or something. But it's brilliant. So if I have like I don't know, a mum who comes in who's got some kids that need OHI, you know, rather than them having to go through a whole hygienist appointment, they can go and see one of the nurses and have all this done. It's brilliant.
Very good.
Yeah.
What strategies can we implement to increase access to dental hygiene services in underserved populations? That has to go to Fiona. Flying smiles.
Well, I want you all to go out there and be mobile. Dental hygienists started off as district nurses, really triaging into practice, and obviously that's what I'm doing through Flying Smiles. And as Jules says, in rural areas and coastal areas, the access to a dental practice is becoming more and more challenging. And for the patients who need oral health care or oral health care advice are often the patients that can't afford to travel on public transport, because there isn't the public transport to get to a dental practice that maybe will accept them as an NHS patient. So, you know, getting out there into your communities and becoming known for the knowledge that you have, so people can come and get advice from you as well. So, like Amanda said, you know, utilising your dental nurse to run these sort of drop-in clinics where discussions can happen, and all across the range of health, as Jules said about the bulimia as as well. So I think there's a lot for us stepping outside bricks and mortar and going out there to those, you know, before COVID, it was 40% patients never attended a dentist regularly. That will have gone through the roof now. So as Phil Dunn said, and obviously it was talked about at the Irish meeting as well, we have got such an opportunity. We have such skills. We need to get out there and use them.
There's mouth cancer screening as well. I mean, that's lacking.
Yeah.
People that can't.
Yeah,
That's really important.
absolutely.
When do you work with head and neck cancer patients?
Mhm. Yeah.
How's your waiting list? Quite long?
No, that I no, we do get them in quite quickly and get them started on their treatment fairly quickly after diagnosis. It can be up 2 to 3 weeks, so we're certainly getting them in, but more screening needs to be done, you know, to not like for patients all around the place. But no, once they have been diagnosed, their treatment starts fairly quickly.
That's good.
Very good. Amanda, tell us about the work you did a few years ago, and I think you still do, don't you?
At the care homes.
Yeah.
Well, I did it more so before COVID. When COVID happened, I wasn't allowed in, so I'm just picking it back up again. But I used to go in and do demonstrations to the healthcare assistants on how to brush other people's teeth, what type of toothpaste to use on a palliative care patient, you know, like SLS free, like a fresh minty actually isn't that comfortable. Different products that they can use. It's just stuff. And like I felt when I first started doing it, I felt like I was being patronizing, but actually they really hadn't learnt this. And it was really useful. And it wasn't just healthcare assistants, it was doctors and nurses as well, that, you know, you just assume because someone's a doctor that they know. Well, they don't. That's our
I
speciality.
don't know.
Yeah.
Yeah.
Yeah, it was
Because
really...
our colleague Judy Keesley does a lot of training with the doctors and nurses, actually.
Yeah, and I've approached my local GP practice actually about running a session. So I have Mondays off now, and I quite like to start utilising that day doing some more voluntary work. And it's not even something I want to be paid for. It's just I want to get out there and help people.
Yeah. Actually, on that note, Amanda and I and 6 other colleagues are off to Tanzania in March to volunteer out there.
I can't
Amazing.
wait.
So
I'm really excited.
yeah,
Sounds amazing.
Yeah,
Yeah, amazing.
keep you
it'll be
posted.
definitely an adventure.
Yeah. So, how do you envisage the patient experience evolving in the dental hygiene over the next decade?
I believe we're going to become independent clinicians more as patients demand more preventative care. Also, we've got the generation of children who maybe don't have so much treatment, so but they get to an age as a teenager where they're released from their parents and discover Red Bull and partying hard. Can you believe?
That sounds awful.
So yeah, I think as we've got a great opportunity, and we do have the skills, and I think it's just about being brave and stepping out and delivering on the competencies that you've got. So
Do you see us perhaps screening for diabetes and things like that?
absolutely. And
We're already doing this.
Yeah.
The students that come to our practice do it. They have the glucose monitor. So it's something that's being implemented already.
Yeah.
We probably can't even imagine what's going to come along in the next 10 years, can we?
I'd really like, and I don't know if this is a bit out there, to be able to write a prescription for fluoride. Because at the minute, like with the new exemptions, we can prescribe fluoride, but all we can do is tell them to go and buy it from a pharmacy or the desk. To actually write a prescription, like for people that, you know, that have cancer or xerostoma from being on lots of medication that get free prescriptions, much more beneficial, isn't it?
Perhaps that might, yeah.
Absolutely.
Yeah,
Oh my God.
not completely out of reach, is it?
No, I mean, when I qualified 28 years ago, and if you'd have told me then that I would be allowed to own my own practice, or
amazing.
you know, do local without a dentist being on site, or you know, do fisher seals or whatever, you know, I'd have been like, my mind had been blown back then.
All stuff that you've been trained to
never
do.
know, do you? You know, kind of how it's going to happen.
I know.
I qualified 40 years ago, and if you told me I'd have to wear gloves and masks, my mind would have been blown as well.
Yes, exactly.
I can remember being a dental nurse years ago, and the dentist didn't wear gloves, and he'd do like the root canal and with the
All of preventative care. How can we think outside the box for that for future hygiene practice? Thinking maybe along the technology lines and apps and things like that again. You know, what kind of, because a lot can be done at home. Why are patients not getting the message? Is it us? Is it governments? What do you think?
I think patients are more and more getting the message, to be fair. I think particularly the younger generation, you know, they're very kind of they're
into
like
their
little
teeth.
sponges, and they're very keen to, you know, kind of find out about how to be healthier and how they can improve their oral hygiene and how they can, you know, what they can do for themselves. So I actually think it will become like that, because they, like you say, you know, they're not from a generation that have had maybe a lot of treatment. But, you know, kind of that's because they want to kind of keep their caries-free status, and, you know, they want to stay, you know, kind of healthy. So I actually think that the younger generation do care a lot about what they can do to help themselves.
what they look like as well.
Yeah.
The Instagram thing has got a lot to do with it, hasn't it?
You've got TikTok, which is, I mean, Anna, I mean, she's got loads of followers on TikTok, and it's really educational, and so younger people love watching things like that. Well, actually, I like it as well.
I was going to say, I've learned so much off TikTok.
I love watching those videos.
There is some great clips out there, isn't there?
Yeah.
And it is educating patients. And what do you think about that then?
I think that's good, as long as they're credible.
Yeah, most of it is good. Yeah.
And evidence-based. Sometimes I see a lot of clips that are not evidence-based. They're not saying the right message. Do you think that should be monitored? Should there be courses on that?
Yeah, and I've seen clips where people have had like a huge amount of calculus under their tongue and cleaned it off, and that person's clearly got learning difficulties, and why are we watching a video of like, it's not entertaining, you know.
Consent's got to be a big thing as well, hasn't it?
But even just some of the messages, the basic messages, some of them, sometimes the facts are not correct.
Yeah, like whiten your teeth using strawberry juice on Facebook, and then people follow it.
Yeah.
So I just,
yeah,
I think the other thing is, and I've spoken about doing something maybe around this, but just on social media, when you are given advice, that it is evidence-based, and also really that you should be letting your indemnity know that you're giving advice to the public. A lot of people don't really know that. So you need to inform your indemnity. So that's a whole other webinar.
It's a whole other webinar.
So what advice would you give to a new dental hygienist entering the profession today?
Don't work 6 days a week, you burn out.
Burnout,
I always say that.
Yeah.
I
focus on lifelong learning.
Sorry, Wenda, go on.
No, sorry. Focus on lifelong learning.
Yeah.
I just wanted to say that, you know, you've got to look after yourself. You've got to believe in yourself. But also things like it's okay to make the odd mistake. So, you know, so long as you learn from it, so long as, you know, kind of you give it your best. Nobody's perfect. But I think so long as you provide services in a safe and legitimate manner, you know, that's what we're all here for. We're all here to kind of help the patient do good. And I think so long as we do all of the things that we're supposed to, the odd mistake is okay. You just have to kind of hold your hands up, you know, kind of say, look, okay, this is a mistake, I won't do it again, blah, blah, blah.
And you've got to
And it's
remember as well, sorry, Siobhan, they're vulnerable people that are laying there. You've got to be ethical,
Yeah.
Yeah.
you know,
Yeah.
don't abuse them.
I was somebody taught me when I was very young that if you always think of the patient as as a member of
Yeah.
your family, and
Yeah,
how you would treat those, or if you were that patient, you
Yeah.
would always kind of make good choices. And I think
Yeah.
you can't fall far away from that, you know, kind of, if
Mhm.
that was your brother in the chair, well, maybe if you don't like your brother, but
Yeah.
you know, like your mum or
Your
your
mother.
dad, or, you know, your daughter or your son. And I just think you can't fall too far away from the GDC expectations then, because you're putting that patient first, you know, and you're doing what's right for that patient.
yeah, just be ethical.
So going
I
back
also
to
think
what
just-
advice would you give? What were you going to say, Fiona?
I was going to say, you know, once you've done your initial oral health assessment, break it down into what your steps you're going to take. Don't try and pack it all into one appointment, because you'll burn out, but also patients only can take in a certain amount. So
Yeah.
just start with toothbrushing and a bit of suprascaling or whatever, or put together your treatment plan and discuss it with the patient. You just take it step by step rather than trying to do it all at once.
I've got some advice. Put aside for your tax. I've fallen foul to that before.
And a holiday.
Yeah.
Yeah, but look
Yeah.
after yourself, you know, because
Yeah.
it's like that
Time.
whole put your mask on first before you can help anybody else, isn't it?
Exactly.
If you're
Totally.
stressed and that, you're not going to be able to help your patients or your staff or your colleagues or whatever. So
That's why I have Mondays off.
I think my advice would be not to work all the days and all the hours God sends. And I know you come out owing a lot of money back, and you know that definitely happened to me as well. And to do things that you really enjoy, take the time, because life's so short, isn't it? But we end up working so hard to pay this money back, and then we kind of lose sight of life, and then our bodies hurt. So I would
And
say,
actually, what's the point then?
yeah, find your side hustle. What do you love? And, you know, and
Enjoy
enjoy,
yourself.
have enjoyment, and keep that support system, have a mentor, a group to go to, I think is really important. So how do you see your own role evolving in the next few years? What are you excited about? So I'm going to start with Wenda.
I was thinking about this earlier, and I was sort of going, I'm down past double digits to retiring, so I'm looking forward to finishing up. But I suppose it's, you know, yeah, that like it's looking forward to that, and I have like just been there to mentor or to bring people along and give them positive advice and be kind and, you know, supportive to people.
Which you really are, Wenda. Yeah, brilliant, brilliant. Jules, you're going to become a corporate.
A conglomerate.
Do you know what? It's been kind of bubbling in the back of my head about whether to franchise or not. It's kind of something that I'm thinking about, but I think for me, wherever that kind of may take me, it's all about the relationship that I have with the patients. I love my patients, you know, and I think to remember as well that when they put themselves in a vulnerable position, because we don't, in general, day to day, we don't let people touch us, do we? You know, society, particularly the younger ones, nobody touches anybody else. So to be able to touch somebody, it takes a lot of trust, and, you know, you have to have a really good relationship with the patient. So I think for me, it always comes back to the patient relationship, and I don't really care what I'm doing, so long as I've got a really good relationship with the patients that trust me to do my job.
I love that.
I love it. Love scratching teeth.
Fiona, what about you in the next few years?
So like Wenda, I'm on my way to happiness. I'm looking to build the business to pass it on to someone else or pass it on to my employees to run it. In Scotland, the registration fee is quite high, so therefore I'm looking at franchising, because I think that's the one way that other hygienists can come on board. The big thing for me is getting investment to get a van with a chair in it, so that I can go into your community, plug into your community centre, and give the community all an oral health assessment, and then be able to either offer them treatment or send their information to a dentist. So that's on the Flying Smiles cards.
Sounds fantastic. And actually, Fiona has a course coming up, a mentoring course, a 2-part course. So we'll post that on the social media, and you can register for that. Jules, people are after you for a course as well. So I'll just leave that with you there.
Yeah, we do need to have another conversation, Siobhan, definitely. There's definitely something to be done there, yeah.
Yeah. Amanda, what about your future?
I don't know. I feel quite happy with where I am now. Like, why can't you just be happy with being in the moment? That's what I'm thinking.
Be in them, yeah.
You know, I feel like I'm at the peak of my career. I mean, as I mentioned before, I've won Hygienist of the Year. I feel really happy about that. I like where I work. Been there for 8 years. I'm quite happy. I love all my patients. I like all my colleagues. You know, I'm able to do things like go to Africa with, you know, NSK. I've got the BSDHT Eastern region. I've got that coming up. I'm going to be their treasurer. So that'll get voted in October. I'm just happy with where I'm at, actually.
Well, you're there. You're doing
Yeah,
it.
I'm here.
Yeah,
I'm doing. I'm living life.
Sure.
I agree with Amanda. I'm happy where I am too.
Yeah.
If you don't love where you are, you know, then why are you doing it?
And then you're always
Yeah.
striving for better, thinking, oh, that's going to be better. That's going to be better. Just be happy with where you're at now and enjoy your life. That's my feeling.
And just as Jules says, enjoy your patients. You know, I have such a great relationship with my patients as well. I'm very fortunate they invite me into their home, and so it's just a different level of love we have.
I must admit, I do fancy the van idea.
Yeah.
I have thought of it.
I'll let you come for a drive.
Spin.
And the Outer Hebrides is amazing, so I might take you up on that.
I have a question here, and I think this might go to Jules, I think. What needs to be on prescription from a dentist for whitening? My practice is looking at me doing it soon. I've done the course and I'm indemnified, but just want to make sure that I get the prescription done correctly. If anyone has a template, would they mind passing it on? Thank you in advance.
For me, I get a dentist in to come do the fit, and they kind of do it because I haven't got a dentist on site. So I can't get a dentist to write me a prescription kind of off, you know, like we haven't got a dentist in surgery type thing. So because we've not got a dentist on site, when I get the dentist to come across and do the dental exam, she just does the thing and I just do the impression.
What do you do a whitening, Amanda?
Yeah, I do. And I was thinking we have got a template, actually. It's on our computer system. We use Dentally, so I could look that up tomorrow when I get into work and see if I can forward it to you. Because when I do whitening, I get a dentist, like whoever their dentist is, I message them and say, can you please put this? And I always make sure that they're in the practice when I do the fit.
Oh, brilliant. Well, if you're happy to share that, and we can
dig it out tomorrow.
If you just send us an email to nskikigai@gmail.com. So that's nskikigai@gmail.com. I can put that on the group anyway. Send an email in and we can send that to Amanda and she'll sort you out for that. Any other questions? Any other questions this evening? In the questions, I think we did get through them all. So thank you very much, Wenda, Jules, Fiona, Amanda.
Thank you.
I enjoyed it. Thank you.
Thank you.
Let's just say thanks very much there.
Thank you.
Any closing quotes or positivity?
Believe in yourself. You can do it. Be brave. Step outside and do it.
And just have
Go on.
confidence in yourself. You've got this far, you've qualified, you know what you're doing.
Absolutely. So, ditto.
Enjoy
go.
it.
Let's go. Just check, make sure that there's a couple of questions. Oh, just saying thank you. Could I have a copy of the whitening prescription also? Thank you all so much. Well, thank you everybody for coming along. Keep an eye out. We've got lots of other webinars coming up. Thank you again to the panel. Thanks for giving up your time. And we'll let you go off and have a nice evening. Take care, everybody.